أهلا بكم في واحدة من حلقاتنا اللي أعتقد أنها هتكون تاريخية ومهمة للغاية وشديدة يعني أقول إيه، شديدة التخصص، شديدة التفاصيل. الكانسر، سرطان، كلمة مثيرة ومخيفة وتقلق، وطبعا في ناس دلوقتي هتروح جاية حاطة ايدها على بقها وتقايلة جمل معينة عشان تحمي نفسها نفسيا من الوهم بهذا المرض. المرض دوت مشكلته انه خطير وغير خطير، سريع ومخادع وبيخطف الناس. خطف ناس كتير قوي، خطف ناس بسبب عدم التنبه لبداية الأعراض، عدم التنبه للعلاجات الحديثة اللي موجودة دلوقتي في العالم. ولذلك النهاردة الحوار عالمي على مستوى عالمي، ضيفة عالمية. لكن واحنا بنتحاور النهارده ما ننساش ان في ناس قريبين منا جدا وحبيناهم راحوا بسبب هذا المرض العنيف. نفتكر مع بعض اشهر محبوب راح بسبب هذا المرض العنيف، طبعا الفنان الرائع الكبير الاستاذ احمد زكي. احمد زكي عانى، كان مدخن شره. احمد زكي حتى الصوره يعني فيها سيجاره، يعني دي صورته بقى وهو بدا بعد ما اكتشفنا طبعا او اكتشف هذا المرض، وكان في مراحل، اكتشف للاسف في مراحل شبه متاخر. الفنان الجميل عامر منيب. عامر منيب برضو من الناس اللي عانوا من سرطان البنكرياس، وده سرطان عنيف جدا جدا. نهاد شريف الله يرحمها برضو من الناس اللي تعانت من سرطان الثدي. الفنانه الجميله نعيمه عاكف برضو نفس الكلام، سرطان الدم، لوكيميا. الفنان محمد فوزي راح في حتت كتيره في العالم عشان يكتشفوا مرضه، ما عرفوش الا في الاخر بعد ما كان المرض وصل الى مرحله متقدمه للغايه. انور وجدي ده له قصه كبيره جدا برضو، ده من اساطير السينما على فكره. طبعا الفنانه الجميله ساميه جمال، واستاذ المطرب الجميل محمد قنديل برضو نفس الكلام، برونكوجينيك كارسينوما. وبرضو الفنان الشاب عبد الله محمود، ودول من اشهر الناس اللي جالهم هذا المرض. حقيقة اليوم سيكون حوار زي ما انا قلت لكم عالمي عشان نحمي اللي بنحبهم من هذا الشبح العنيف، نشخص بدري، نعالج بدري، وايضا نفهم الاساليب العلاجية الجديدة. الحوار هيكون مع ضيفة من نوع خاص، طبعا اسم عالمي كبير واسم شهير جدا، famous name across the world. يعني اداء رائع جدا 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 في عالم الكانسر، واسم كبير جدا. هي ضيفتي الاستاذ الدكتوره أوزلام رئيس قسم طب الاورام بكليه الطب جامعه أجيبادم، واستاذ طب الاورام بمستشفى أجيبادم، الاسم العالمي الكبير.
Every year 14 million new cases are appearing, cancer cases.
Cancer spread. The number of the patient increase. What is the cause of this spread?
Targeting the tumor, not the normal cells, but only the tumor.
We will find the cancer.
Kind of indirect way of fighting cancer.
If we do this investigation.
Lung cancer, then the treatment is completely different from other causes of hemoptysis.
الأستاذة الدكتورة أوزلام رئيس قسم طب الأورام كلية الطب جامعة أجيبادم، أستاذ طب الأورام بمستشفى أجيبادم.
Dr. Ozdlam, welcome to Egypt.
Thank you, Dr. Ayman.
I am so glad to make this interview with you. You are a famous name, you are international name and related of the treatment of the cancer and immune therapy. This is a new trend of the treatment of the cancer. But first of all, I want to ask the most important questions. We noticed that the cancer spread and the cases maybe increase, or we notice it early. We in the past watch a cancer patient not frequently like now, but the number of the patient increase. What is the cause of this spread and the increase of the number of the patient of the cancer?
Yeah, you are right. Cancer is very common all over the world, and also as well as in Egypt. We know this. All over the world, every year, 14 million new cases are appearing. Cancer cases are appearing. They are diagnosed. They are diagnosed more compared to old times, but also the numbers are increasing. We know this. It's because of, most of them are because of smoking, alcohol, viruses, the infections, especially in this region, infections are very important. And again, older population get more cancer because when we age, we get more cancer. And also some chemicals, maybe air pollution, they are all contributing to cancer causes.
I want to ask about if there is a general symptom can be noticed by the patient itself related to all types of cancer.
Right. Cancer is actually a sum of more than 200 diseases. So we cannot tell one symptom for all cancers. But if we notice lumps or bumps in the body, in the breast or in other place of the body, then we should be careful. Again, long-term coughing, non-stop coughing without any reason, fever without any reason if we have fever, unintentional weight loss, unexpected weight loss, again unexpected bleedings from the mouth, from the nose, or from gastrointestinal system. If you have a unintentional, unexpected bleeding, then you should be aware that there is a problem. It cannot be all the time cancer. Thanks God, it's not always cancer, but we should be aware that it can be cancer. So, and we should seek for medical advice.
Of course. Here in Egypt and the Arabic area, Middle East area, different from European population or European behavior related to certain symptoms you mentioned. The lump here in Egypt may be diagnosed or think as abscess, just abscess.
Right.
And I have a friend lost time and died. A very close friend, long time ago, because he have a lump, but diagnosed as abscess.
I see.
And later on, it's discovered as a leukemic patient.
I see. Yeah. So if we discover any lumps or bumps in the body, or for example change in the skin lesions, they are also important because you are rich from the sun here. So sun is important cause of skin cancer called melanoma. So if you have some skin changes in the body, and if it is bleeding or if it is ulcerating, then again you should, as a patient, you should seek for medical advice. And also doctors should be aware that this can be skin cancer. Okay.
In this episode, I'll ask you about 3 types of cancer. Breast cancer, bronchogenic carcinoma, and the cancer colon.
Right.
In October, this is the month of the breast cancer all over the world. Right. We know this. But breast cancer has special situation here in Egypt. It's a very important and spread, and the late diagnosis, late treatment, and wrong way of treatment may lose the patient his life or her life. Also, it occurs in male, such as in female. First of all, I want to ask about the cause of breast cancer.
Yeah, breast cancer is the most common cancer among females, and also in Egypt it's very common among females. It usually occurs in older ages, but it can also be seen even in 20 years, like 20, 30 years of age. So we shouldn't tell that, okay, I have a bump in the breast, but it is I'm young, I don't get breast cancer. No, please be aware that it can occur in any age, but most important causes of breast cancer is getting older, getting hormonal treatment for any reason, getting hormonal treatment, because hormones are very important in appearance of breast cancer. Again, giving childbirth at old ages, at later ages, it's a risk factor. Family history is very important. If there is a case in the family, for example, your mother, your sister, or your aunt has breast cancer or ovarian cancer, then you should be aware that your cancer risk is higher compared to the population, and you should also do breast examination by yourself and also visit the doctor for breast examination.
Of course. Is it the lump appearance or mass feeling just a symptom of breast cancer, or there is another symptom?
Yeah, of course, there can be other reasons like infection, abscess, or fibrocystic disease. It can be any cause, but we should be aware that new appearance of lumps or bumps, and we always say that they are not painful in the cancer, but they can be. Sometimes they can be painful, but mostly they are not painful. Also nipple discharge, it is important, nipple discharge, bloody nipple discharge, and bumps in the underarm, axilla region, underarm. If you notice some lumps or bumps underarm, then this lymph node enlargement may be a sign of breast cancer or an infection, but it should be, of course, examined.
Yeah, to exclude the presence of cancer.
Right.
Many female here in Egypt or in Arabic area are afraid from going to certain place, a certain center, a certain hospital to make the diagnostic investigation. They said, we will find the cancer if we do this investigation.
Yeah, and if we can find, then we are lucky, actually. If we find the cancer early, because it occurs, we know that it is common. It is almost 1 in 8 women there is a breast cancer. So why not diagnose early? And if it is diagnosed early, then the treatment is very successful, and the success rates are even higher than many diseases. It's above 90%. You get cured. You get the best treatment available. So don't be afraid of asking medical advice and going to hospitals. It's not ayıp. It's not a shame. Please go.
It's not عيب. مش عيب. It's not a shame. مش حاجة.
If it is there, it will be diagnosed early. It will be found. And for diagnosis, one of the best methods is biopsy. So sometimes they also believe that putting needle into the tumor or putting knife into the tumor is causing spread of the tumor. No, it's not causing spread of tumor. It's for diagnosis. It's necessary. And if it is not cancer, it can also be diagnosed with biopsy. It will say that, okay, this is benign, this is normal tissue, so you will be relaxed. And if it is cancer, then you will get the treatment.
Okay. What's the importance of the early diagnosis? How far the early diagnosis play a very important role in the treatment with a very good or adequate results?
Yes. Early detection reveals early diagnosis, early stages. So there is no spread to the lymph nodes or to the body like liver, lung, then we call it early diagnosis. And for early diagnosis, the treatment success rates are high. You get cured. Even with one pill, like hormonotherapy we call it, if the tumor is hormone responsive, and also breast conserving surgery is possible, so you don't lose your organ, it's there, and then you get a hormonal pill. It's called hormonal, but actually it's anti-hormone, against the hormones. You get the pill and you get cured. So early diagnosis is important at this point regarding the treatment results.
Okay. There is a very new advances and a very important progression in the treatment of the cancer breast. I want to explain to our viewership, what is the new treatment? What is the new methods of the treatment?
Yeah, currently we are treating breast cancer specifically for the tumor and for the patient. So we don't say that this is one treatment and it fits all. No, we don't say this. We check the patient characteristics, we check the tumor characteristics, and we call it genomic profiling. So how aggressive is the tumor and what kind of markers does the tumor have? So according to these results, we make a plan for treatment, and this treatment plan also has some targeted approach, targeting the tumor, not the normal cells but only the tumor. So tumor carries some specific characteristics, and if you target these characteristics, these tumor characteristics, with little side effects, you get the most benefit from the treatment.
Of course, it is a very, very helpful treatment, and will reach to the eradication of the tumor itself without affection of the tissue of the breast. And that's the dream of every woman. I want to ask about, there is a new progression or new treatment have a special situation or can be fitted to all types of breast cancer?
No, that's why we check the tumor characteristics. We check which characteristics this tumor have. For example, one patient's tumor may have ER/PR, like estrogen progesterone receptors, then this patient is suitable for hormonal treatment. Another patient's tumor has HER2 receptors. This is a growing protein, growth factor protein, which causes the tumor cells to grow faster. In the old times, we were saying that it's bad because it causes the tumor cells grow faster. But now we have many treatment options for these kind of tumors, HER2 positive tumors. So we give these specific treatment modalities with chemotherapy, combining with chemotherapy, and then we get actually unbelievable results, even complete remissions.
Of course. When I told my patient there is an immune therapy,
Right.
the translation of immune therapy in Arabic is a very threatened word.
Oh, really?
علاج مناعي. It's a very, very threatened word. The patient, when hear about immunotherapy, he think I lost immunity.
Right.
How to explain to our patients this immunotherapy have a very important advantage?
Right, because cancer is actually, cancer cells are our own cells, and our immune system accept them as our own cells, and they don't attack these cells. But with immunotherapy, we actually boost the immune system. We increase the effectiveness of immune system to attack the cancer cells.
Increase the immune effect,
Right.
not decrease the immune.
No, we
yeah.
just boost the immune system, and the T cells, the cells responsible for our immunity, they attack the tumor cell. So it's kind of indirect way of fighting cancer.
You are a tailor. You are a tailor. You are may have a combination therapy for this patient. You have the special therapy for this patient. Both of them have a cancer, but you have a tailoring of each one for each case. A suitable treatment for her.
Yes, this is actually right. We are tailoring the treatment. We are discussing the cases at multidisciplinary setting with surgeons, radiation therapists, pathologists, molecular biologists. We all come together and we decide the best treatment for the specific patient. So this may not be the best treatment for another patient, but for the specific patient, we decide how to combine the treatments. Surgery may come first, then the hormonotherapy, chemotherapy, targeted treatment applied, or first chemotherapy is given, the tumor gets smaller, so the patient has the chance to protect her breast. Only the lump is taken out. Also, the axilla, the underarm, is very important. We take out the lymph nodes, and sometimes if all the lymph nodes are taken out, so there are many options for the specific patient. It's not one kind of treatment, it's just combination of many treatments and discussed at tumor boards, so the experienced doctors, surgeons, molecular pathologists, they will all tell their decision for the patient.
Okay, I'll start the second part of our episodes today. Very important episodes, I think, lung cancer. I told my student all over the past of years, if you find 50 years old patient, more than 50 years old, smoker, has a history of smoking, past history maybe of smoking, we consider him as a bronchogenic carcinoma patient until improved otherwise. Am I right?
Yes, you are right. You are right, because smoking is the most important cause of lung cancer, and it is very common, especially in men, but also it is increasing in women because of smoking, because of chemicals. There are many reasons for this. So we should first exclude the lung cancer. Because there is the lung cancer, then the treatment is completely different from other causes of hemoptysis. So we should see whether the patient has lung cancer or not. If there is a lung cancer, then if surgery is possible or not, because for early diagnosis, surgery is the mainstay of the treatment.
So, what is the most important symptom must be noticed?
Coughing.
Yeah.
If there is coughing without any reason, unexplained coughing longer than 3 weeks, also hoarseness related to voice, hoarseness, weight loss. These are the most common symptoms, but in the later stages, of course, pain is important because it can spread to bones, then it makes pain. Again, it can spread to brain, then some memory loss, some epileptic attacks, but they are late diagnosis, of course.
What is the the most important diagnostic investigation must be ensured to do? Here, maybe perform plain X-ray.
Plain X-ray is good, but it's not enough, because you cannot see small nodules with plain X-ray. So it's better to do chest CT, computerized tomography. And for computerized tomography, nowadays we have low radiation tomography, so you shouldn't be afraid of getting radiation from this tomography. Even for screening, we use these CTs. So CT is good to see the nodules, the masses in the chest, and then followed by bronchoscopy, of course. This is for diagnosis and for taking biopsy.
What is the importance of early detection of this disease, and how it the early diagnosis help to the prognosis, to improve the prognosis of the treatment?
If it's diagnosed early, there is a chance of surgery for this cancer, especially for non-small cell lung cancer. Small cell
carcinoma.
Yes, for small cell carcinoma, we don't consider much about surgery, but for non-small cell lung carcinoma, surgery is one of the options, and then followed by chemotherapy or chemoradiotherapy. And this again increases the chance of treatment. Is similar to other cancers actually. If you diagnose early, the chances are higher for getting cure.
The question, the most important question, the rule of all medicine all over the world, the protection, better than the cure.
All right.
How I protect myself against this?
First of all, as we talked before, quit smoking if you are smoking, and if you didn't start smoking, just don't start smoking. And also passive smoking is important. Many women and children are exposed to smoking in-house. So I don't know how it works in Egypt, but in Turkey now it's forbidden to smoke in closed areas. So in restaurants,
also in all over Europe, London,
in restaurants, anywhere.
London
in
is
schools,
forbidden.
Right, it's
forbidden. If you want to smoke outside. That's it.
Yeah, because not only your smoke, but also it affects you, and also it affects your loved ones. So be careful for this.
Now, new techniques and new treatment, new methods of the eradication of this carcinoma have been developed.
Yes, right. Actually, we call now cancer as a treatable disease, and even lung cancer, it is treatable.
Curable.
Curable. I hope we can say this in the near future, but it's treatable because we again check the tumor characteristics, especially the targets on the tumor cells. If these targets are present on the tumor cells, then we have small molecules. We call them small molecules because they are pills. They can be taken orally. It's like a antihypertensive medication or diabetes medication. So you prescribe a bottle of drugs to the patient and they take it at home.
I wrote about chemotherapy treatment in the bronchogenic carcinoma, but in all the books, and we don't mention the immunotherapy. What's the difference between immunotherapy and the chemotherapy?
Right. Chemotherapy is the medical drugs. They are attacking directly to tumor cells. Tumor cells are dividing cells in the body. So they are increasing rapidly. So these chemotherapy drugs are effective against these dividing cells, these rapidly proliferating cells, because cancer means actually rapidly proliferating anarchic cells. They are not in order. They are proliferating like pop-ups everywhere. So
I love your term, anarchy. Anarchy behavior. Yeah, cancer, anarchy behavior.
In the body.
Yeah.
So these chemotherapy drugs are attacking the cancer cell. The immunotherapy drugs, they are first boosting the immune system, and then the immune system is attacking the tumor cell. Again, killing the tumor cell by a means of immune cell. So it's indirect way of treating the cancer.
Okay. Sure, the time is very important to have the benefits of the immune therapy.
Right. Even at the beginning, at metastatic stage, this is very actually current information. 2 weeks ago, it was explained in one of our big meetings at ESMO meeting that we can use these immunotherapy drugs for first-line treatment of lung cancer. So it's very effective in extending the survival of the patients.
Of course. I'll go to cancer colon. These cancer colon, symptoms of cancer colon neglected here in Egypt so far. And also, many symptoms of related to cancer colon, such as hematemesis, blood in stool, may be neglected or be ashamed of effort to go to the hospital or go to the doctor to said I have a blood in stool.
Yeah.
First of all, cancer colon is a very dangerous and spreaded cancer colon.
Right. It's a disease of men and women, so it can occur in both sexes, in men and women, and it increases by age. So actually we recommend every person at age 50 to get colonoscopy for early diagnosis because when you have symptoms it's little bit late, but still there is chance of treatment. So if you have bleeding in the stool, abdominal pain, abdominal mass in the you are palpating the mass in the abdomen, or unintentional weight loss, it's also important. Change in bowel habits, it can be diarrhea or constipation. It's not always constipation, it can be also diarrhea. So if there are this kind of symptoms, you feel like there is something going on in your intestines, then you should seek for medical advice, you should seek for medical examination, and the colonoscopy is the gold standard for diagnosis. That's why we are asking for colonoscopy at age 50, so we can detect polyps early, and before cancer development. Actually, it is preventable cancer. It's better than early diagnosis. It's preventable. You take out the polyps and then the cancer is prevented. And if it is familial, then at earlier ages you should do colonoscopy. If there is a case in the family for familial polyposis, then these polyp numbers are above 100. It's like thousands of polyps. So around age 20, even age 20, you should start checking the colon, and if there is this problem, then it can be preventable by, for example, prophylactic surgeries.
Is the treatment with the new lines of therapy, such as the chemotherapy or immunotherapy, is a rigid way? Have you no modulation? You can change your decision after the notice certain changes related to the cancer itself?
Right. It's not decided once. It's a progression time. You start at the diagnosis, but you follow the patient all the time. There may be changes in the tumor, there may be changes in the patient. So the treatment will be switched from one point to another according to the characteristics of the patient and the tumor. So this is a teamwork actually. The main actor is the patient in the team. It's in the center. So we are working for the patient. As a specialist, medical oncology, radiation oncology, surgery, radiology, pathology, we are all serving for the patient. So the patient is the center of the team. And the team is working for this purpose.
I know you visit Bahia Hospital. What's your opinion about the rule of treatment or the way of treatment and protocol related to the cancer in this important hospital here in Egypt?
Yeah, I'm very impressed with what I see in this hospital. Actually, the patient is there in the center and they had a good infrastructure for radiotherapy, for medical oncology, and for surgery. And for diagnosis, they have the facilities for diagnosis. So I think Egyptian women are very lucky to have this kind of centers. I hope it will increase in time and they will get more benefit from the modern treatments.
As an international name and a very famous name, I'm so glad to make this interview with you, and I am impressed I know your name from a long time ago, and I want to ask you about the difference between the Arabic patient and the European patient. You treat both of them.
Yeah, actually, as you told, I see Arabic patients, I see Turkish patients, and I had some experience outside Turkey. So Arabic patients and Turkish patients are similar actually. We are a little bit, sensual people. So we don't like hearing much about cancer word. So maybe we should be familiar with the word. The cancer is not something frightening. Yeah. It's not something frightening. Just we should be friends with the disease, not fight against the disease. I will tell this.
What is the most important thing you like here in Egypt?
People. Yeah, they are very friendly. They are very
kind.
Yeah, they are very kind, and also. Of course, pyramids. They are.
You watch pyramids?
Yeah, last time. This is the second time I'm coming to Cairo. The first time I came, I visited, and I'm impressed, of course.
You are welcome. طبعا ضيفتي العزيزة كانت الأستاذ الدكتورة أوزلام إير، رئيس قسم طب الأورام بكلية طب جامعة أجيبادم مؤسسة طب الأورام بمستشفى أجيبادم الاسم العالمي. هنختم بزيارتها لمستشفى بهية، اسم كبير، وسعدني جدا بهذه الزيارة، وسعدت بتلبيتها لدعوتي في هذا البرنامج لمشاهدة الفكر العالمي على أرقى مستوى للعلاج بالأساليب الحديثة لمن كان هو المرض الذي يقال له الخبيث أو المرعب، والذي كان يطل بوجهه القبيح فيقلب الحياة إلى جحيم، وربما يدمر عائلات ويهد السعادة في وقت ربما غير منتظر. أرجوكم ابقوا معنا.